Hello, everybody. Good morning. It is Wednesday, and I am going to go ahead and dive right in. I promised you I would be talking about functional medicine services and different tips and tricks along those lines. As you know, I own a wellness clinic, and we do functional medicine consultations and custom testing services. But I have lots of experience in independent pharmacy, and I see that it could pair beautifully with the services that we offer in independent pharmacies. And so I just want to bring some information to you guys. Hopefully, you find it helpful. At the end of this, I'll go ahead and post the form again in the comments so that you can go ahead and ask any questions that you have along the way. And I'll be doing these videos every week, so I hope you find value in them. So use that form to ask me any questions that you have, just about anything functional medicine related. If there's a different topic that you want to dive into, then please let me know in those forms. But I'll just go ahead and get started. So the first thing I wanted to do is start today just by talking about the growth projections of the kind of the functional medicine market and supplement market in general. So the complementary and alternative medicine space is projected to grow by 22% between 2021 and 2028. So that is an enormous percentage. And the supplement industry is projected to grow about 8 to 9% between those same years. So the reason that I bring this up and kind of start with this is just to show you that functional medicine is here to stay. It's not, some fad that is going to kind of come and go and maybe make you look silly, make your business look silly. But this is something that people are interested in, and I don't think that people are going to stop being interested. And just based off of those growth projections, you could kind of see how this might be an avenue that you want to either expand on if you're already offering it in your independent pharmacy, or something that you might want to start implementing. So that's what I wanted to start off with. The complementary and alternative medicine space and supplement industries are growing. And they're projected to continue to grow well, up to 22%, like I already mentioned, to between 2021 and 2028. So not only is that important for, financial reasons, but also it allows us to offer services to our community that they're interested in. So that's the other way I look at it. Obviously, people are interested in this, so if it works with my business model, then why can't I offer it to my community? And this could turn into a thing that your community is turning to your business for answers, for products, whatever you want that to be. I know some different independent pharmacies do actual consultations, but you don't necessarily need to if you don't want to, although that could be a revenue stream in and of itself. It can those consultations can spin well into selling some additional supplements. It can spin well into maybe making recommendations on just regular medication changes or custom compounds that you could offer them. So those consultations really could spin well into other services and other products that you may or may not already offer, not to mention some vaccines. So it pairs well with things that you're already doing. The other thing too is that you don't, like I said, you don't have to offer, functional medicine doesn't have to equate to you sitting down with a patient one-on-one and diving deep into their medical history. Maybe that's something you don't have any interest in doing. Maybe you feel like you need more experience and more education and you're not interested in doing that, and there's really no problem. There's so much free information out there that you can get as much or as little as your time and interest allows. But the thing I want to point out is that you don't have to go that route. You can just learn little tidbits here and there so that you can just continue functioning as a pharmacist the way that you are now, but maybe expanding your knowledge base to include more complementary medicine. And that could be things as simple, vitamin D is a really good example. We have obviously seen this uptick in general practitioners ordering for vitamin D labs, but we could take that one step further and continue to educate the patient as to why that's important, what levels they might be looking for, what supplements are good quality, maybe their vitamin D levels aren't moving. You can get into conversations like that. I kind of equate, if you're not interested in doing one-on-one consultations, which is completely fine, I kind of equate the other end of the spectrum as being very similar to your typical OTC conversation. You know, somebody comes in with a complaint and they're looking for some type of over-the-counter product, whether it's cough and cold or they have poison ivy and they want to know what you recommend. It could be the same exact type of dialogue, but instead we're doing it in more of a holistic fashion. And there are tons of research studies to support what it is that people are doing in more of a holistic way. Now, do prescriptions and some standard over-the-counter products trump some of the holistic things? Absolutely. But there is a place for you, if you're interested in it, no matter how big or small, for you to go ahead and start expanding your knowledge base in order to have these simple conversations with people. But also, if you want your pharmacy to be a place where people go to get answers, it's very easy for you to go ahead and start positioning yourself that way. Because as soon as you start having those conversations, those people that you're talking to, they then start telling their friends, and their friends start telling their friends, and you become, let's say maybe you become like the supplement hub, or you become the consultation hub. So some different ways I kind of see this blending well with some of these other services that we all talk about so regularly for independent pharmacies and expanding into more of a clinical service type base. I just see it pair functional medicine and just complementary medicine in general. I feel like it would pair well with many of the other clinical services that you're already doing, even on a very basic level. So things like remote patient services. I'm not sure if you've heard of chronic care management, remote patient monitoring. If your pharmacy is involved in that at all, it's where you have touch points and you're communicating with physicians' patients on a monthly basis, and you're getting a portion of the reimbursement for that. But not only could you position yourself to do that, but during those conversations, you could position yourself to also then sell additional supplements, not unnecessarily. I'm talking justified things that are there to actually help patients. That is what we're doing. We're not there just to make another buck. We want to help people, but you could be the person, if you're doing these remote patient services, you could be the person that's not only helping them on a month-to-month basis with their overall health and wellness, maybe hypertension, cholesterol, so on and so forth, but you're also helping them by providing them a little bit of a more holistic approach as well, if that's something that they're interested in. And that goes well beyond vitamin D. So many studies on different supplements, for example, berberine being used for patients with glucose intolerance and insulin resistance and diabetes. So the list can go on and on. Same thing with point of care testing. You know, what about people coming to you for COVID or flu or strep tests? They're sick, right? So you could be a place where they could get some immune boosting supplements, as basic or complex as you want it to be, and as much as your interest in the topic allows. Same thing with maybe hormone replacement therapy is something that your pharmacy is already highly involved in. It's important that those hormones are cleared appropriately, so we want to be focusing on detoxification pathways. We want to be focusing on just different things to help support the patient, and your pharmacy could possibly be the resource for that. The thing that also is really neat about it is that you could also start offering these patients, like these hormone replacement therapy patients, you could be the source for the additional testing. So there's all kinds of different specialty tests out there, where the panels get shipped directly to the patient's house, and you guide them through the test collection process. They ship them back directly to the lab, they process them, and then you, as the ordering practitioner, would get the results. Again, that could turn into a consultation if you wanted it to, but not only is this a financially beneficial revenue stream for your pharmacy, but you're also starting to position yourself as more of a provider if that's something that you're interested in, and also just a health and wellness space. So maybe that might get some different people kind of walking through your door, depending on what your pharmacy's already set up like. Again, the over-the-counter recommendations, people aren't always looking for the standard prescription and OTC recommendations that we're so commonly discussing. You know, your Tylenol, your Motrin, your aspirin, pain creams, and so on and so forth. People want more holistic things, and so you could position yourself and your pharmacy to house some of those items. And then also, you know, maybe you're into pharmacogenomics or nutrigenomics testing. That's another way that you could you know, bring in some different clinical services and maybe have a little bit of a more functional medicine or complementary medicine type spin on it, because the nutrigenomics is kind of focusing on your nutrient depletions and kind of how that's impacting your health and wellness. So supplements align very, very well with things like that. Same with pharmacogenomics. We're all kind of, it's like you kind of slowly see this shift, but we're only seeing a little piece with traditional medicine, like the vitamin D or the MTHFR mutation. That's just one little itty bitty mutation, whereas pharmacogenomics is going to look at a huge panel of things like MTHFR, that if this person has that, you could be the resource that they're going to help them feel better. With, like I said, those supplements, maybe additional testing. So that's another thing I wanted to come in here and say, that I just really feel like, in my experience, that there are a lot of different ways that you could position yourself and also just start to help your local communities with clinical services, specifically functional medicine, and pair it with other things you're already doing, kind of like a little spin-off. So just to finish up, I want to give you a little bit of a behind the scenes on what we do. And what we do is we provide one-on-one consultations, but I've gone and I've hired a physician assistant. There are a couple reasons why I did that, but one being that I wanted people to have another choice of a practitioner, and also the prescription ability. So that's where what I am with my business right now. I'm trying to expand and kind of be the full circle of what a patient is looking for. A lot of common complaints that I get from people that are looking for consultations are that they don't feel like their doctors are listening to any of their complaints. They don't want another medication. They're not interested in medication at all. They don't feel like they have enough time to explain, or they're just being brushed off. I can't tell you how many times patients tell me that their doctors literally made them feel terrible about what they were doing and that they're crazy. And that's not the case. And so we are always touted as the most accessible healthcare professional. And so I just feel like independent pharmacies could not only be this dispensing location, but also turn into more of a health and wellness space, if that's what you want to turn your pharmacy into. Because people are looking for it, people need it, and people really do trust their pharmacies, especially their independent pharmacies that they already have relationships with. So that's something that we're doing. We do the functional, the specialty testing that I mentioned. We do some hormone panels. We do some stool testing panels to look for gut imbalances and dysbiosis and all things gut and poop related. So we do that, and then we also do food sensitivity tests. If you're looking to bring in a specialty type test to kind of get your get your feet wet and just see how it goes, see how your community is receiving it and interested in it. A food sensitivity test is a really great place to start because it's simple. They're simple to read, and the things that you can kind of recommend are pretty easy. So if you want me to get into like protocols and whatnot regarding any of like what I would do with the results from like a food sensitivity panel or anything along those lines, I'm happy to share that kind of information with you guys. But those are some of the things that we offer. And then also we offer some of the supplements, but I am trying not to position myself as another supplement hub because, like I said, I'm personally not an independent pharmacy at this time. We're a wellness clinic, so a lot of the supplements that we offer tend to come from other companies, but that, if you don't want to have a lot of stock of supplements on your shelf, or you're just kind of dabbling and you don't want to waste money because you're not really sure if it's going to sell, there are ways that you can do that. There are companies that they are essentially the warehouse for all the supplements, and then you get a small kickback. You're not making a bunch of money off of the supplement, but you are offering a service to your patient and you are kind of embedding yourself into their care. So there are different ways that you can do that too. So next week I'm going to pop back in, and my plan is to go into a little bit more detail, maybe bring you guys a couple examples on how you can get involved in functional medicine. It's obviously a little bit of a wave of the future. We've probably been hearing about this for some time now already, decades even, but it's going to continue to grow. And so I think that if this is something that you're interested in, then it would be fantastic for you to start to kind of dabble in ways that you're comfortable with doing. So like I said, next week we're going to dive into how you can get involved. I'll kind of dive into maybe a couple small ways, and then I'll also get into a little bit of detail if you wanted to do like one-on-one consultations and kind of where to start with that. I hope you guys have a fantastic day. And again, if you have any questions, make sure you go ahead and either pop it in the comments or fill out that Google form. Have a great day, guys.